Good day, everyone. I hope you're all doing well. I'd like to welcome you to an episode of the Journey to Healthcare. And today's episode is going to be plastic surgery. Today we have Dr. Ahmed here with us. So, Dr. Ahmed, would you like to introduce yourself?
Good morning, everyone. Good morning, Imam. Thank you very much for this for the invitation. It was really nice of you. My name is Ahmed Al-Gabri. I am a junior doctor in the Department of Plastic Surgery in Khawla Hospital. Yeah, I am a simple man. I really like to I like my work a lot. I do a lot of exercises. I like volunteering works. What else? Yeah, basically that's it. I'm a simple person.
That's lovely. It's a pleasure to have you here with us today.
Same as well.
So, what got you into medicine in the first place?
Well, it started a long time ago when I was a student in high school. I always wanted to help people, and I was always thinking that medicine is really it has a future, and there's like a lot of fields that have not been yet discovered or fulfilled, or it still has a lot of potentials. So those are like basically the reason that led me to go into medicine. And also, it was also a challenging field. That was one of the main reasons also that made me go into it. Um, I like the challenge. So that's the reason I accepted or I choose medicine as my future career.
Yeah, lovely. Also, I agree that medicine, the nice thing about it is like it won't really stagnate generally. Like there's always lots of options you can navigate through. So
Yeah, for sure. Yeah, medicine is like wide and huge field where the only limits is your imagination. And I believe there is no limit in imagination. So everyone can be a star in it. Just if he had like the right dream and he was committed and hardworking on it.
Yeah, definitely. Okay, so now I finished with medicine. Now, why plastic surgery?
Wow, that's a difficult question. All right, why plastic surgery? I believe there was no specific reason, to be honest, but as I told you earlier, plastic surgery is one of the fields that are um, has a lot of potentials in the future, and with the modern era, with the artificial intelligence and the new discoveries, I guess the field will expand rapidly, and that's one of the reasons that made me go through it. Also, I guess as plastic surgery is a highly demanding specialty, and that requires a lot of mental and physical endurance, um, because there are a lot of surgeries that requires a lot. Sorry, not like a huge or a lot of. In other words, there's like it takes a lot of hours. So you got to be like focused. You got to be like precise about what you're doing, thinking ahead about the next step that you're gonna take. All of these things, for me, it's fascinating. Also because plastic surgery is it can change the lives of so many people. Like for example, like pediatrics patients who have for example, like craniofacial anomalies, you can't imagine the life change that those patients might have in the future. So if you think about it in a while, that would give you a lot of motivation to do it. What else? Yeah, and I guess it is, as I said before, it's highly demanding and difficult specialty, but it is not difficult for those who are accepting the challenge and those who are loving what they are doing. So if you have those characteristic, then there is nothing difficult for you. You're always gonna be good at what you're doing. Yeah, I guess that's pretty much it.
Okay, yeah, that's great. Especially as you said, it really does change people's lives, like in both, I feel like the emotional part and the physical part as well.
For sure, yeah. Totally agree with you. It's fascinating. It's like fascinating, because there's so many aspects of like patient's life. There's like physical, the emotional, the psychological, etc. And all of those are acceptable or ready to change whenever you are ready to change the patient. So yeah.
Yeah, definitely.
Yep.
Okay, so like in the plastic surgery, then what are like the bread and butter cases that is usually like the common cases you see? Or before?
Okay, so for example, in the most common cases we are encounter are the reconstructive parts, all right? The reconstructive part of plastic surgery. So we had wide variety of cases. Like let's start, for example, the craniofacial surgery. For example, like craniosynostosis, a craniofacial anomaly, a cleft lip, cleft palate. If we start going down the body, there's like you have like anomalies of the ear, anomalies of the nose. You go down, maybe you can encounter some patients who have like burns, and burns is like a total different word, what else? Yeah, body defects, soft tissue defects, where we have to do like for those patients like free flaps, local flaps, how to cover the defects, It's basically like it's like a puzzle, and you got to know how to solve this puzzle. What else? Yeah, that's pretty much it.
All right. And usually most of your cases, you have like long follow-ups with the patients, I assume.
Yeah, for sure. For example, like patients of burns who have like burns, the hospital stay can varies between a couple of days until up to months. And that's only the hospital stay. It's not like the follow-up period, The follow-up periods can extend up to years. So there's a lot of follow-ups with patients. So you got to build like a good relationship with the patients. They need to trust you. You need to build up trust between you and the patients. And I guess this is also one of the things that led me or encouraged me to go into the specialties, because you are building good relationship with the patients, and I like to talk with the patients. I like to explain to them what's going on with their in their minds. What do they want? What their expectations? All of these things I really appreciate.
Yeah. And I think maybe this aspect is important when choosing a specialty, if you want like a long-term patient relationship, or you just want like, for example, emergency medicine where you don't have that aspect.
Exactly. Yeah, exactly. That's a really important point to highlight is that how do you like I guess you're going to ask me about this question later on, but it's really important that you know how to deal with or how you're going to imagine uh, you as a doctor being in the hospital dealing with patients. Whether you would like to spend more time with the patients, whether you like to as you say, in emergency medicine, where the patient doctor encounter. I mean, there's not a lot of follow up between the doctors and the patient. So I guess it's a really important point, as we mentioned. Yeah.
Okay. Now we'll go a bit to a fun part, which is the common stereotypes of plastic surgery. All right. So, like you mentioned a lot of reconstructive, but I feel like most of the public, when they hear of plastic surgeon, they automatically just think of cosmetics. So, like
Yeah.
in residency training, do you usually focus more on reconstructive cosmetic, or is it like balanced? Like, how does that usually work?
Yeah, so for example, in the hospital where I'm working at, we are focusing on the reconstructive parts. I agree that there is a stereotype, as you said, about plastic surgery, which is, I guess, it's hugely influenced by the social media and the media, as you know. But the reconstructive part is one of the important specialities that requires a lot of dedication, requires a lot of hard work, requires a lot of um, hours of studying, hours of training, all of these things. So regarding the stereotypes, yeah, I got a lot of like people, you're working in the plastic surgery, you're gonna fix my nose and blah blah
Yeah.
blah these things. So I said, well, it's partly true, but there's a lot of different how do you say it, like different other important or huge or big bunch of plastic surgery, which is the reconstructive part. So I guess this stereotype look is going to change in the future somehow by your series that you are doing. I guess I hope that it will reach to the public audience.
Hopefully.
Yeah.
And then another stereotype, which is about plastic surgeons themselves, that they are perfectionist type, and that's what helps them in the field. Is that true?
Don't you think all doctors are perfectionists?
Well,
I guess, well, it depends on the personality, to be honest. I'm not perfectionist, to be honest. But when the issue comes to the patients, I need to do, I don't like, I think of the patient as, um, or I think what I'm doing to the patient is there's no way for the error, you know. And I guess all of us should think that way. If you are treating a patient, you shouldn't think of any like 1% of an error. Of course, we are human, we can do errors and these things, but you got to be perfectionist when you are treating your patients because it's our duty as doctors. It is as a legal and as an ethical way, we should be really good at what we are doing with the patients. But regarding for example, regarding for me, I don't think that I'm a perfectionist. uh, um, Sometimes I like to, for example, like my room, I like to make my room like really perfect. And I like to organize my day, but sometimes you are out of the schedule doesn't go through what I want to do. For example, if I plan for like 30 minutes nap, that 30 minutes nap will end up like 2 hours max. So that's the only thing I guess that I am.
That's very
Yes.
relatable. I also can relate.
Yeah, I guess.
Never the time you planned. It's never the time you can plan for it.
Yeah. But I guess no one is perfect. But regarding treating your patients and doing your job, I guess you should be perfect in it.
Yes, definitely. Okay.
Yeah.
So what type of med student do you think perhaps plastic surgery would be a suitable choice for him or her?
Well, I guess everyone is suitable for what they are thinking of doing. Everyone has the chance to do it. Everyone has the chance to do whatever they want to do in their life if they have the right mentality, if they have the right dedication, if they have the right support. So those three things are really important. Um, so let's say if you want to go into plastic surgery, what should you do? Well, you should choose a mentor. That's the first thing. You should have an overview or just like experience the specialty because a lot of people, for example, when they are thinking about plastic surgery, when they see the reality, or let's say when they see other different specialties. For example, when I first started, wanted to go into choose my future career, I went to different specialties like orthopedics. But when you actually work in the specialty, it might change your mentality differently, you know? So this point, you need to keep it in your mind, like what you're going to do in the next 10 to 20 years, or what you're going to do for the rest of your life, you know? Yeah, that's a really important point.
All right. And regarding the job, like, is it type of like on-call heavy, if that makes sense? Like, or is it like the job, the working hours basically? How heavy is
Uh,
it?
Well, it depends on the day to day. Well, some days, for example, let's talk about the normal working day. Our work is divided between the OTs, operation theaters, um, clinics, daycare, and ward work, right? So, for example, let's talk about the OTs. The OTs, we have different varieties of cases, as I mentioned earlier.
Yeah.
Some of the cases can doesn't take a lot of time. Other cases might take huge hours. I mean, a lot of hours. For example, let's say we might start one case might take 4, 6 hours. Or even more. It depends on the type of the case. Some of the cases, like where we had to do microvascular surgery, where you can tie the small vessels and small nerves under the microscope, those might take a lot of like even more than that. Some cases might not take a lot of time. Yeah, that's about the OTs. Regarding the clinic, we basically see a lot of patients in the clinic. So I guess it's almost the same as the other specialties. There's not a lot of huge difference between the number of patients. But regarding the on-calls, you can't expect what you see in the on-call, all right? Sometimes on-call might be quite quiet. Some other on-calls might be like really like tough, and you need to you don't have like a lot of time to rest and these things. So you got to accept all. You need to get all of these expectation in your mind. So once you are on the on-call, you got to be like ready mentally for that. So yeah.
All right, let me see. So it's basically one day you get this, you have to like, you can't expect it.
Yeah.
Yeah.
Yeah, it's not always like you're not always in struggle and you are not always in rest. sometimes this, sometimes that.
Yeah.
So yeah.
All right. And last question I want to ask is about research. How important is it? How important research is for plastic surgery?
Well, it is really important as compared to other different specialties, because in research you are some people might think of research as something I want to improve my CV. I guess this look should be changed. You should look as a research as you are part of a community. You are part of you are part in the team, and you should think of that as you are going to improve the current idea about what you're gonna do. So it's really important in that way. So I guess it is mandatory for everyone to pursue this idea and work on research so they can improve the healthcare system and to improve their to make something better for their work or their specialty. Um, yeah.
Yeah, all right. So I think at Medstudent, all these like research courses and stuff, we have to pay attention for it. For like,
Yep. That's really important. Also because you are seeing, for example, when you're participating in conferences, you're working in research or you're participating in a course, for example, like you meet a lot of people, and I believe like in order to get like well in your specialty, you need to get. It's not always about the skills or the hard work you're doing in the work, but also you need to get like really good communication skills. You need to have a lot of when you meet other people, you need to build good relationship with them so you can share the knowledge, and to also yeah, just basically to share the knowledge between you and them, and yep.
yeah, that is indeed very important. Okay, so like, do you have any closing remarks for any my student watching this?
Yeah, I might have one closing remark. Always be passionate about what you're doing, all right? And always surround yourself with people who are encouraging you. And if anyone is thinking about something, um, he should pursue that thing, all right? And doesn't mean that if he fails once that the door is closed. No, uh, I guess I believe is if you fail, that is like an attempt for you to or is like a kick for you to go for the other attempt, and the other attempt should always better than the previous attempt. So that's a really important thing, because a lot of people are, once they can't do it the first time, they just like simply quit. But I don't think that's the key to success. Always you got to pursue your dreams. You got to work hard. You got to have the set of mentality that is that you are not a quitter. You are a fighter. So all of these ideas should like be in your or be in everyone's mind. Um, and yeah, always try to live your life or live your day as it is the last day. Do work, do exercise. For me, I do a lot of running. I'm not that perfect, but I try to be. I like trail run so much, so I try to participate in races as much as I can. It's not because like I want to be the first place. Of course, I won't get the first place because I'm not that fit. But it's like the environment, the encouragement to see the vibe, all of these things makes you like really motivated, and yeah, it's a really nice thing. So yeah, that's my advice for whoever's watching me or watching me.
That's such great advice. Like, it's true. Like, perseverance, it's hard, but you have to have it at the back of your mind. Like, you have to,
Yeah,
like,
you
not to
got to
stop. Yeah.
you
And
got to be
also,
consistent. Be consistent of what you do.
yeah.
Keep going. Yeah.
Also, I like that you mentioned running. Like, I think also is important. Especially, I feel like med students need to start developing this habit. So when they start residency and move forward, they have like a side hobby or something they can do to
Yeah.
help them maintain work-life balance type of thing.
Yeah, it's not necessarily also to be running. It can be swimming, it can be whatever you like. What's like satisfy you mentally and physically. You should go into those things. So for me, I feel like running is a really good thing for me. So that's why I do it. And I guess everyone should try it as well. It's difficult, a little bit difficult in this weather, but sometimes in the winter, there's also so many other alternatives in the winter, or you can do indoors running. All of these things are really nice.
Yeah,
Yeah.
right. So I think this sums up our episode for today. Thank you so much, Dr. Ahmed. I really enjoyed this episode and I had so much fun talking to you and I gained a lot of insight. Before,
Same,
there's different knowledge now.
same for me, Imam. It was really nice to have this interview with you. And yeah, uh, whatever you have any other like interviews or any questions, I will be happy to answer it anytime.
Thank you so much. Have a good day.
Thank you very much. Have a good day as well. Goodbye.